Hello everyone. Today we're gonna be talking about the anatomy of the pinna. So in this video we're gonna be looking at the anatomy, the function along with the innervation of the pinna. Along the way I'll also point out some important one-liners which may come as MCQs. So please do make a note of them. So let's start. If you look at the external surface of the pinna, the first thing that you will notice is the helix. This is a prominent rim of the auricle. Then you have the antihelix. Right opposite to this, you have the tragus. And knowing about this tragus is important because if you'll press the tragus in a person who is suffering from otitis externa, which is the inflammation of the external ear, it is going to elicit a lot of pain to the patient. So this will be called a positive tragus sign. And this sign can be used to differentiate between otitis externa, where it is positive, and other diseases where upon pressing the tragus, there will not be a lot of pain. And if there is no pain, you will call this a negative tragus sign. So the tragus is useful for the tragus sign. Next, you have the antitragus. So this is easy to remember. You have the helix, antihelix, and tragus, antitragus. Next, you will notice this big depression in the center of the pinna. This is called the concha. The concha is divided into two parts by the anterior extension of this helix. So the two parts are the cymba concha, which is the superior part, and the cavum concha, which is inferior. And last but not the least, we have the lobule. Now let's talk specifically about the lobule. So the first thing that you should know is that the pinna is made by a single piece of yellow elastic cartilage, and this cartilage never ossifies. Next, the cartilage is present everywhere in the pinna except the lobule. So this lobule only contains fat, it does not contain the cartilage. In perichondritis, the lobule is paired. So to understand these last 2 points, I'll take a separate diagram to explain further. So first you should know what is perichondritis. So perichondritis is the inflammation of the tissue which lines the cartilage. So the perichondrium basically provides blood and nourishment to the cartilage. So whenever this area is inflamed, the whole auricle will also be inflamed. And as we just saw, the lobule does not contain this cartilage, it only contains fat. So what are you going to see in perichondritis? You will see that in this area, there is redness, there is edema, the pinna will be hot to touch. So basically all the signs of inflammation will be there, except the lobule which will be spared because again, this does not contain the cartilage. So this is a very classical MCQ in which they mention that the person presents with inflammation of the auricle. Upon examination, sparing of the lobule is seen. What is your diagnosis? And the answer to this is perichondritis. Now one very important point is that the cymba concha is the anatomical landmark for the mastoid antrum. So the mastoid antrum is basically a space right behind the middle ear. I will be talking about this in another video which will be specifically directed towards the mastoid antrum. But for now you just need to know that the cymba concha is the anatomical landmark for the mastoid antrum. But you should differentiate this with the suprameatal triangle or the McEwen triangle because this is a surgical landmark for the mastoid antrum. So there are two landmarks, anatomical and surgical, so you should remember both of these. Next, we need to know about the innervation of the pinna. So I've taken two pictures here. On the left side, I have the anterior surface of the pinna, and on the right side, I have the back of the pinna. So the medialmost part of the anterior pinna is supplied by the auriculotemporal nerve. Then, the tip of the back side of the pinna is supplied by the lesser occipital nerve. Next, the concha, both the anterior and posterior surface are supplied by the 7th and 10th cranial nerve. And last but not the least, which should be the easiest to remember, is that the greatest portion of the pinna is supplied by the greater auricular nerve. Lastly, we have the functions of the pinna, which are pretty straightforward. So the pinna is useful for collecting the incoming sound waves, and then it funnels them into the EAC, which is the external auditory canal, and it also slightly helps in increasing the amplitude of the sound. So that's it for this video. I tried to cover a lot of questions which they might ask in the exam, and I will be posting more questions on my Instagram, so please visit that. Thank you for watching.